SIBO Remedies for gut health. Are you struggling with bloating all the time? You cannot digest your foods very well and you're just feeling uncomfortable from all that bloating? Well, let's explore effective SIBO remedies that could help restore balance to your gut and helping you feel better. So first things first, what is SIBO? Small Intestinal Bacterial Overgrowth. SIBO happens when too much bacteria grow in the small intestine where they shouldn't be, because a lot of these bacteria, which is actually good for us, should be in the big intestines, the large intestines. However, if you have overgrowth, it starts to creep into the small intestine, and then the bacteria start fermenting food in the wrong place, which leads to this symptoms like bloating, gassiness, diarrhea or constipation, fatigue, and brain fog, not digesting very well. So when you are dealing with SIBO, antibiotics are often prescribed, but there are natural remedies that can be just as effective if you're looking for a gentler approach. First, you want to figure out if you have SIBO, and that would be to do a breath test. So you can ask your doctor for a breath test and actually get diagnosed with either hydrogen or methane or hydrogen sulfide SIBO. There are herbs like garlic, neem, black walnut, oregano oil, caprylic acid. These have natural antimicrobial properties that can help reduce bacterial overgrowth in the long term. And these herbs can actually target bacteria causing the issue. However, they also have to be taken for a longer period of time. So instead of just a 2-week antibiotic therapy, they could be taken for 1 or 2 months. And they are a little weaker, so they might have less side effects than prescription antibiotics. Before starting any protocol, always recommend to talk to your healthcare provider, make sure you're on the right track, and that your treatment is tailored to your needs. After you treat your SIBO, no matter what it is, whether it's herbal or antimicrobial or antibiotic, you do want to retest to actually see if it went away 2 weeks after you treat. Now let's talk about the diet. The Low FODMAP diet for SIBO is a game changer. FODMAPs are certain types of carbohydrates that can be difficult to digest and actually may fuel the bacteria in your gut, making your symptoms worse. So you do want to cut down on high FODMAP foods like wheat and dairy, certain fruits, certain vegetables even, that can give your digestive system a break, reduce the fermentation process that causes bloating and discomfort. But don't worry, it's not forever. With this period of elimination, you can gradually reintroduce foods later on, one by one, to see what's actually best for your body. It's about finding that balance. It is a very restrictive type of diet, so it can be really hard to do. So that's why it's more of a short-term type of diet while you are doing your SIBO removal protocol. While probiotics are typically beneficial for gut health, they can be a little tricky with SIBO because adding probiotics too soon can actually be feeding the bacteria that you already have out of balance. And imagine you have already bacterial overgrowth and now you're giving more probiotics. So after you've reduced bacterial overgrowth, there are certain probiotics that can be a great tool to help restore the balance in your gut bacteria. I generally recommend probably spore biotics because they will only open up in your colon where the bacteria needs to go, not all over the place like in your small intestine or your stomach. So if you have SIBO, look for a spore biotic, one that also has a lot of different types of strains. Fermented foods like sauerkraut or kimchi and kefir are also excellent natural sources of beneficial bacteria. Again, the timing is key. You want to do it probably after you remove a lot of that SIBO protocol. And if you want more information about probiotics for your gut, you can watch this video over here. We're going to talk about digestive enzymes and gut support. These powerful little helpers break down food in your stomach, making digestion easier, reducing the burden on your gut. And if you're struggling with SIBO, these digestive enzymes can help improve their bloating. Eating a digestive enzyme prior to every meal could be really beneficial. Things that have betaine HCl, which is an acid, can help also break down and help you digest foods better, reducing bloating. Along with enzymes, consider adding gut healing foods to your diet like bone broth and ginger. These can help soothe and repair your digestive lining, and these foods are great for reducing the inflammation in your gut as it heals. Managing stress is a huge key to the SIBO puzzle, as stress can really disrupt digestion. When you're dealing with SIBO, that's the last thing you want, more stress. So make sure to incorporate stress relieving practices like yoga, deep breathing, walking outside. Movement helps move your gut along, and that's essential for preventing bacterial overgrowth. Gut mobility and gut motility is actually very important. So with SIBO, sometimes we also try gut motile supplements like peppermint or ginger or Atrantil. If you have your doctor, they can prescribe low-dose naltrexone. These things can help move your gut along, so you're moving the gas away also. Try eating smaller meals, but you want to give more spacing to them, so at least 5 hours in between meals. This can help make digestion a little easier, reduce your bloating. If you're always feeding the gut, then you might have more SIBO. So try meal spacing and really give a nighttime without food. And if you have recurrent SIBO, you might want to see if you have environmental toxins like mold or mycotoxins, heavy metals, genetic issues that are continuing to suppress your immune system. So when I see recurrent SIBO, I always test or ask about these environmental toxins and try to detox those, help your immune system so that long term your body can get rid of SIBO for good. If you found this helpful, make sure to like, subscribe, come see us for more gut health tips. Remember, you're not alone in this journey. Take care of yourself. I'll see you in the next video.